Hi, this is Celeste, and this is Celestial Wonders. And tonight I have a very special broadcast, and I have an insider from public health. And this person needs to remain anonymous. So we are going to do things a little bit differently than we typically do. And I know that you understand that position because all of you follow the news. And so let's just leave it at that. And I certainly know what it's like. So let's get started. So tonight's topic is going to be on public health. And Celestial Wonders is the show where we explore the cosmos, the mysteries of the cosmos, the mysteries of the earth changes, and the mysteries that are before us all around. And so we're really honored to have Sammy with us tonight. Welcome, Sammy.
Thank you, Celeste. Thank you for having me.
So you work in public health. Approximately, how long have you worked in public health?
At least 7 years.
Okay. Okay. So is this something that you always wanted to do, or you just tripped upon it, or is this something that you knew from a young child that you wanted to go into and you got into this field?
I have always been interested in public health, and I started my career in the healthcare field, and eventually I did this position.
Okay. Do you want to give like some basics of what is public health in your perception and understanding, and some basic things for the viewers to know?
Sure, we can do that. I believe the first thing that the user can know about public health is that it is a very small part of the health or medical field. The health field can basically be broken down into four main groups. First group is the clinicians, and those are going to include most of the people who you regard as healthcare people. It's your doctors, your nurses, your pharmacists, your dentists. The clinicians are going to be people who see patients. They are the one-on-one, they are the boots on the ground. And they are by far the most visible and largest field in the medical field. And the second group of folks, they're going to be more the administration. So these are going to be folks who they do the paperwork, they are the support, they keep things going in the background. They don't necessarily see patients, but without them, the supplies, the equipment, the grounds, all of those things will not be taken care of. The billings, those things need people, need expertise. And then the third area is going to be the R&D or the academia. So this is going to include the government organizations as well as higher education. These are the folks who are going to do research. These are the folks who are bringing in the multi-million dollars worth of grants, and they're going to study, in the case of public health, specific infectious diseases, especially emerging diseases. And then comes my field, public health, which is the smallest field. It is the least visible field. In fact, I have a saying in public health: if you're doing public health correctly, nobody knows about you. And however, public health is very important. We work in the background in that although we're not clinicians, in that we do not see individual patients, we look at public health and we prevent diseases overall. We look at populations, we look at groups of people, we look at whole holistic areas, and we identify trends, diseases, emerging things that are a danger or a threat to large groups of people. So again, if we do our jobs well, we pretty much remain out of the public conscience. And until recently, we have remained outside of public conscience. Most people have no clue what public health is. They don't have an idea where we are, what we do. Nobody, no little person grows up and says, I want to be in public health. They grow up and they say, I want to be a clinician, a doctor, a nurse, a dentist, or I want to do research on certain diseases. It's the other fields that get most of the limelight. Public health is still a very important part, but it's a very small part.
Okay. So what I guess what's the burning question in everybody's mind is, what is your take on the COVID-19?
Right. My take is that COVID is real in that there is an infectious disease going around, and it's called COVID-19. The response to it and the narrative surrounding that response is not proportionate. It is not real, not based on good science, solid science. It is not based on solid data. The protocols that public health has used in the past for other infectious diseases, and we have hundreds of infectious diseases that we look at, we monitor them every single day. And all of those hundreds of diseases, we follow the same standards of protocol, the same standards of science, the same standards of surveillance. COVID does not follow these things. For some reason, COVID gets a hard pass. The data that supports COVID, as far as anything with testing, deaths, um, I question those. Why? Because the very basic tenet of having a definition for COVID is what for COVID is what what is COVID? What are the strains of COVID? What constitutes the onset? How about testing? Those things have not been firmly established. Those things have changed so often that I don't believe the solid data is there to establish true public health surveillance when it comes to COVID.
So would COVID be a notifiable disease to either the state, the federal government, or the United Nations?
Yes, COVID is definitely now an officially notifiable disease. States have it written in their laws, a list of diseases, and it ranges anywhere. It's usually about 100 diseases that each state has listed. And these are going to be diseases that, if there's an occurrence of that disease, it is by law required to notify, to go into a database. And then after it goes into the database, professional surveillance is done to mitigate it so that there is no spread. COVID is now part of that list with every single state. I don't follow the WHO, so I don't follow internationally with how they have handled it, but I do know that every state has it written their code, that COVID is an infectious disease that must be reported.
So COVID is the manifestation of the disease in the person, and it's the coronavirus. So is the coronavirus a notifiable disease?
Yeah, coronavirus is a general term of a group or a family of viruses that includes, lots of different viruses out there. COVID right now is definitely, COVID-19 is definitely taking the forefront as far as being the type of coronavirus that is taking the headlines, the funds, all of the resources, and it's affecting all of our lives more than any of the other coronaviruses right now.
Yeah, that's been my, from what I see also. So in the past, why don't you walk the viewers through the surveillance organizational chart, a flow chart? So a person goes to their clinician, to their doctor, they're sick, and then what happens if it is something like COVID, not COVID, because that's a hot potato, as you say, but in a typical, what is a normal flow if you go to the doctor and you're sick with, let's say, some type of a virus?
Right? If someone is sick enough, they feel that they need to have professional care, they go to their doctor looks at them, and according to the symptoms, the doctor will say, I believe you might have XYZ. And then the doctor is going to order a very specific test for either XYZ or XYZ and ABC. So the tests are very specific. When we think of tests, we think, oh, the doctor put in a test for me. Well, that's not going to cover everything. The doctor had to very specifically order that test for that infection that they believe is causing your sickness. So the order goes in. When the lab tests it, if it comes back negative, obviously, nothing. But if it comes back positive and it's identified as an infectious disease, depending on the disease, certain diseases must be identified like right away. And that means it goes into the state's database right away so that it can be professionally surveilled and for contact tracing. Right now, contact tracing is the hot term. Contact tracing is just one small part of the overall infectious disease surveillance process. Case follow-up, patient follow-up, all of that includes your going to the doctor, ordering tests, getting tests done, looking at labs, putting it into databases, notifying all the different entities, parties, mostly state and county and hospitals and labs who are involved in this, and then following up with the patient, and that's where the contact tracing comes in, is the following up with the patient. But again, that's just only a snippet of the overall patient infectious disease surveillance process. So once the lab comes back, if it's positive, it goes into the state database. The state database will notify the county. Now, each county is going to have their individual accounts of what infectious diseases are going on for their jurisdiction at that time. And they do not have the ability to see what other counties have. So they go in, and when they see that it depends on the disease. If a certain disease is there, they have to follow up with that patient right away. Other diseases may take more time. So each county is going to have a special team of public health workers, and they're going to do the epidemiology or the surveillance part of things. If they get bogged down or if they have questions, the state is always there to assist them with things like case definition, onset dates, symptoms. If things have progressed to the point where surrounding counties or adjacent counties may be involved, that's where the state really gets to coordinate multi-county, what we call outbreaks. And then if certain entities or places need to be quarantined or shut down, then if it's a small matter, then the county can do that. But if it's a larger matter, especially if it concerns several rural counties, then the state usually steps in and assists with the quarantining of those types of things. And those are going to be things like long-term care facilities, schools, restaurants, and outbreaks in regards to like foodborne things with food chains, grocery chains.
So now, we're faced with this COVID situation. I don't know which you want to tackle first, the contact tracing or the testing. What should the viewer, let's just pick testing. You go to the doctor, you've got some symptoms of a virus, maybe not all of them, just a couple. Should a patient get tested? What are the dangers of getting tested? And are there any long-term effects afterwards from the test?
In regards to testing, there are three main types of tests. Each has its own pros and cons. The big thing about testing is it really depends on what type of test, from which company is doing the test, and the type of test kit, and when the test was administered. Some tests are going to be more sensitive to dates than others, like onset dates. Other tests are not going to be as sensitive. So there are three main tests. There's going to be the first is the PCR test, the polymerase test, and that's been around a very long time. Mm-hmm. The polymerase chain reaction test is something that is going to be, it's not going to be sensitive to necessarily anything antibody-wise, because that's going to be a serology test that's going to be very sensitive with dates when your body has produced the antibodies. So the PCR test is something that is going to look very specifically at DNA. Sometimes it looks at RNA as well, so it's known to be quite accurate. However, having said that, it's also known to be expensive, and it takes time, and it takes specialized equipment. So not everybody will do or will have a PCR test available. Which brings me to the next test, which is the serology test or the blood test. And this is going to be an antibody test. This test, like I said, it's going to be time sensitive. So if you do, if a serology test was done on you before your body was able to create antibodies, it's going to turn up as a negative, and that's not good. However, serology tests can also be false positives as well, because the serology test, it may find an infection, but it may not be able to rule out the common cold. In other words, a false positive might result from a serology test, just because of the nature of the sensitivity of the testing. Again, it really comes down to the company that made the test and when the test was administered. So especially serology tests are very sensitive to time. If you get a positive serology test, if you get any test, if you're able, ask your physician if you can get a copy of that test. You paid for it, it's yours. Ask as soon as you can to get a copy of that test so that you have it in hand. So whatever the result of that test is, you're going to have the evidence of what that test was. Every test result is going to be different because there's really no street standard as to how to report these tests. But basically, it should have minimum the type of test, the testing company, the lab that tested it, the date collection, and the result. And depending on what the test result officially was stated, someone like myself can look at it and then ask the patient several questions and then determine, was that a valid result? Was based on the actual documentation of the test and the patient's question answers. And then the third type of test is going to be the antigen test, and that's going to be a test that looks for protein in the membrane of the virus. This test is usually not as accurate as the PCR test or the serology test. However, these tests have become very popular lately just because they can be quick. The turnaround for these tests can be anywhere from 15 minutes to 2 hours, and they can be very inexpensive. So unlike the PCR, there's no specialized equipment that needs to be done. Unlike the serology, there's no sensitivity with when the specimen was collected. So this test is getting very popular. There's at least probably 14 major companies right now investing this type of testing, even though it's not as accurate. So we're hearing a lot about the accuracy of tests. Usually that comes down to either the serology test being taken at an appropriate time or the last test, the test. That is just, it has never, the antigen test has never really been considered that accurate. It's a good test to start with, but the PCR and the serology tests are more accurate.
So if you were a policymaker, would you think that it is a good idea to have the patchwork, different types of tests, non-standardized, so that it may be one test is more effective from one company and one is maybe not so, and that way, you can have better surveillance? Or as a policymaker, if you were in charge, would you like complete standardization of the testing, like with one company, and they have to use certain markers and have certain standardized procedures and values and all of that?
I think standardizing tests is going to be difficult. Tests are, the test kits are produced from commercial companies, and therefore it's for profit. The policy really does not address how these companies come up with test kits and testing protocols and testing procedures necessarily. So that's a difficult area for me to answer. What I do advocate is that, especially because we have those three main types of tests, there should be more openness and more discussion with those three different types of tests, the PCR, serology, antigen tests. I think when the headlines are there and people say these are positive, it's a positive test result. Well, what test was it? It really does mean a huge difference. Which of the three were done, when they were done, how sensitive that test was, and even PCR tests and serology tests, which tend to be quite accurate. Companies have come back and said, we've had mistakes done in the testing kits. I remember such things happening for Ebola. So there's really no standard per se, and therefore policy revolving testing kits is not an easy area.
Yeah, I have to laugh. So back in like 1980 or something like that, I was in dentistry and I had gone to my allergist and he did lab work, And so I get a phone call at work and they say, you have to come right down to the hospital right away. You're dying. And I said, I feel pretty good for dying. I really felt really great, but because I did work with patients, and we did work with syringes, they thought I was dying of hepatitis. And so for 2 weeks, it took 2 weeks for that test to come back. And I was terrified to get near a patient, because you never know, as the syringe, even though you wore gloves and stuff, sometimes accidents happen. And so I was terrified. And then it came back that, we had mixed up the blood and it wasn't you at all. So I had a 2-week scare there. So listeners, don't just panic. You want to make sure. And if you're feeling great and they're telling you you're dying, it's probably, a glitch somewhere in the system. It's not infallible. So some of the things that we've been talking about are, as far as testing, there is concern and there has been information, I've never vetted any myself, that people have gotten tested for COVID and then come down with COVID, and it was suspected, at least as was relayed from the testing kit, that there might be a possibility of upping the numbers a bit by putting it in the test kits. What would you say to that information?
Are you saying that the test kits themselves may have the COVID virus and therefore infecting the patient?
Have been tainted, yes.
Okay, I have not heard of that at all.
It's actually quite out there.
Okay.
So, and it's been out there since testing started. So it might be something maybe you could get back to us on. Another thing that maybe you do know is, okay, so this is one of my big things. Matter of fact, I just filmed on it this morning, is that with testing, they do have your DNA and RNA. And in the old days, it pretty much just stayed with you and your doctor and the lab. But now that this is an emergency situation and they have opened up the quantum computers for research and development, um, around the world. So basically, they strip the information, like they wouldn't know it was particularly you, but all your DNA, possibly your RNA, are going into that quantum computer, and it could be used for many different purposes. Let's say outside of the COVID, maybe to look at non-communicable diseases or other types of things. What would you say to that question?
Right, the PCR test, that's the DNA slash RNA test. That does collect um, your DNA. As far as it going to databases and surveillance systems, I do know that in the past, every state had its own separate database for infectious diseases. COVID has changed that. Systems are now being integrated at a very fast rate. I don't know if they're using quantum computers and things of that sort, but I do know that the state databases are being integrated with at least one federal, if not two federal databases. And it's really multi-databases being integrated together. So at the state level, it's two main systems. It's going to be your standard infectious disease database, as well as your vaccination database. And in the past, that has never happened before, but COVID has changed things. And so those two state databases are going to be integrated with at least one federal system as well. And there are supposed to be protections put in place, with patient information, with confidentiality, all that kind of stuff. But we live in different times right now, and that's all I can say about that.
So actually, the HIPAA laws were suspended due to this emergency. So you really do not have the privacy that you did in the past. You still sign the paper, but there's no privacy. It was in the Federal Register that they suspended it for the duration of the emergency. And while we're talking about emergency, before we go on to contact tracing, how long can it, in your estimation in public health, how long can an emergency last? Is an emergency like 30 days? Is it a year? Can it last a decade? What is the definition of an emergency and how long it can last?
Right. There is no set time for how long an emergency can last. They've been known to last months or even quite possibly years, depending on the type of infection. I remember when Ebola was going around in certain places of the world, they were declared emergency areas for well over a year, if not years, multiple. I believe COVID is going to fall into the years category.
Okay. So let's jump to contact tracing, and your thoughts on contact tracing and them putting apps on our phone, and what do you think about the no contact tracing phones and all of that?
Okay, so contact tracing is being beefed up in all jurisdictions, the county level, the state, and the federal level. So an unprecedented amount of money is being poured into COVID as far as test kits, treatments, vaccinations, and then finally, our topic right now, contact tracing. Mm-hmm. So in regards to contact tracing, most jurisdictions have hired at least 4 times the number of contact tracers on staff. And these are going to be new contact tracers whose sole job it is to do COVID. That's all they're doing. They're not concerned with any other infectious diseases. Mind you, we still have at least 100 other infectious diseases out there, and those diseases have not taken a break. And we still have pertussis, malaria, all the vector-borne, all the food-borne. Those things are still there infecting people. But the surge of contact tracers that have been hired on recently, they're specializing in solely COVID-related contact tracers. And these people are going to be mostly part-time workers, and they have varied backgrounds. Initially, they were recruited from the military and from other government organizations because President Trump had aligned our armed forces to assist in vaccination been testing and contact tracing. So that was around the March to probably up until now time zone. Recently, we have a new wave of contact tracers who are being recruited, and these are also going to be temporary part-time, but many have healthcare training. They're different than that middle, the military / armed forces / government workers. This new wave of contact tracers, they have backgrounds in either nursing or infectious diseases or epidemiology. It's going to be very difficult to be aloof with this current wave. And with this current wave, most jurisdictions are going to require that added, those added credentials, like a nursing degree. The pay is not bad, usually from $20 to $35 per hour. And then, mind you, again, there are still hundreds of other diseases out there that still require surveillance, still require contact tracing. That's not part of this new wave. So contact tracing is here to stay. And although you cannot opt out of contact tracing, if you want to stay engaged with society, you can at least remain alert. So I'm going to give you some tips here, some inside scoops on what I would do as a public health professional in keeping one step ahead of the contact tracers. You brought up specifically phone apps, and I'm going to address phone apps. I'm going to address regular phones, and I'm going to address in-person contact tracing. Okay, so two main types of contact tracing, phone and in-person, and by far phone is the more common. So common, in fact, even commercial companies are getting in with contact tracing apps, like you said. So currently the CDC does not recognize any contact tracing apps from any government type organization. In other words, no current contact tracing app is from a federal public health agency. So unless your state or county has authorized its use, you can legally remove or deactivate any contact tracing app from your phone because, as of this date, because the CDC has not recognized. Now, state and county rules are different, but the CDC says we do not authorize any smartphone contact tracing apps. That does not mean that those apps are not out there. Now, commercial companies, especially the big ones, they have contact tracing apps, and many folks have these apps automatically installed on their phone. These are not public health focused apps, but they're commercially focused. However, the likely future is that government agencies at all levels will eventually partner with commercial giants with contact tracing apps, contact tracing devices, and health management and monitoring gadgets. So when this comes to be, you will not be able to legally delete or deactivate these apps any longer. So right now, we have this sweet spot time period in which if you have a contact tracing app, and if you choose to get rid of it or deactivate it, go ahead and do it. In the future, you may not have that luxury. So the solution, there's no 100% solution for the future because that scenario has not yet come past. So for now, to prevent the current wave of commercial apps, this is what I would recommend. First, use a non-smartphone, what we call a dumb phone, as your main calling device, okay? Use your phone as a phone. What a novel idea. So the plain old phones, by and large, are immune to apps. There's nothing to download. So there's no contact tracing with the old, what we call flip phones or dumb phones, or the old, or even in the old past, it was called the analog phone. If you must use a smartphone, and many of us must use smartphones, I recommend getting a generic brand smartphone with Android 9 and do not update the phone's operating system. So the more apps and features that you enable on your smartphone, the more privacy you're going to use. So go to the phone's app list and turn off or uninstall all unused apps, especially turn off anything Google, because that is the primary contact tracing app that is auto-installed on phones now. So do a search for Android 9 phones and see if your phone provider supports an Android 9 phone. Most still do for now. An Android 9 phone will still let you do almost anything other smartphones can do. It's just an older model. And if you set it up properly, it will not, number one, it will not have the contact tracing app automatically installed. And number two, if it's installed, or actually you can prep your phone so that it does not auto install. And number two, if it is installed, you have a much higher likelihood of either deleting it or inactivating from an Android phone. So the way to do this is to look for an Android 9 phone that you like, call the phone provider that you want your service from, and ask if they will support XYZ brand phone that you found in Android. And use these words specific when you're talking to the customer service rep. What if I ported my number with this brand phone? Would that work? And the customer service person should be able to say, yes, we support that brand phone. But if so, thumbs up. So the key is to keep your smartphone basic and to turn off unnecessary apps if you have a smartphone, especially anything from the tech giants. Also, befriend someone who knows how to turn these apps on or off, especially the younger generation, a grandchild, a niece, someone from church, a neighbor. When you hand them your phone to deactivate, stand right there and peek at what they're doing. You do not want them to do anything that's going to compromise your security. In other words, only hand your phone to someone you trust. So another key is to layer your defenses as far as not only just the apps, but contact tracing in general. It's like, keeping your home secure. You do it in layers, right? So the first rule of keeping yourself protected from contact tracing is, don't use a phone with an app. If you do have a phone and you do have an app and you do get direct calls from a government contact tracer, don't talk to them. In other words, in the world that we live in today, we learned as children, don't talk to strangers, right? If you get if on your phone, if you get a phone call from an unrecognized number, don't pick it up. It's that simple. You have thwarted the ability for them to contact. Okay? If they can't contact you, everything is great. Everything is fine. So do not pick up the call if the number displayed is not from someone. The next layer is, when going to a public event, do not leave evidence that you can. In other words, do not leave your name on signed lists or attendance sheets or roll calls, etc., if at all possible. So these are the first things a contact tracer will ask for when they get to the part that talks about close contact, okay, on their questionnaire. They're going to ask if you attended a wedding, if you attended a banquet, or is there a list of attendees? Okay, you do not want to have your name on that list if at all possible. So that means at public places, without attendance sheets such as churches, large functions, such, sit in a different spot every week and sit somewhere inconspicuous. So you've protected yourself with another layer. So even though you're not on a list, you've not identified yourself as being part of the group, because at church, if someone at church is infected, they may ask the pastor, who else was there? There's no sign of this, but they're going to ask, who else was there? If you sit in an inconspicuous spot, or if you change spots, no one can tell if you were there or not. You knew if you were there. God knows that you were there, and that's the important thing. The third rule, if a caller asks if this is Mr. or Mrs. XYZ, do not answer that question. So immediately ask who is speaking and why. So this really goes for all calls, not just contact tracing calls. This is how you protect yourself in this dangerous world. Do not identify yourself first to the strange caller. It's your phone, it's your number, you're in control. Make them identify themselves, their motives first. After the caller has identified themselves and their motive, if the call is something you do not wish to answer, simply say, no thank you, and then hang up. Now you know if that caller was actually a contact tracer and they did the right thing and said that I'm a contact tracer from XYZ agency, now you know that you were on the list of calls to receive contact tracing. Use this in your favor. You know now that strange numbers on your phone, may perhaps be a contact tracer. So the next time you get a non-recognized call, what do? You remember rule number 1 and you do not answer. Okay. What should you do if a contact tracer has contacted you successfully? If you get past your first, second, and third line. Okay. And this happens to all of us. We have moments of weakness, whatever. We took that call that we shouldn't have, even though we didn't recognize them. Okay. What should we do? They're on the line with us right now. So if you do talk to a contact tracer, it is the law that you must answer their question. However, I have not found anywhere that states how you must answer. And that's going to be the key. So when asked who this is, actually, when they ask if is this a good time, if the contact tracer calls you and says and asks, is this a good time to talk to you? Say no. When asked, oh, when is a good time? Say, I'm not sure, I'm in the middle of something and I'm very busy now. If they want you to explain, then you just keep repeating that. I'm very busy now, I can't talk to you. And if they press for an appointed time to call you back later, just say, no, I'm very busy now, I can't talk to you. You know, be polite, but try to quickly end the call by saying, I'm in the middle of something and I'm very busy. It's okay to keep repeating that over and over. Practice it, in fact. Practice it without any voice inflections. Just practice over and over. I'm very busy now. I can't talk to you. And don't feel guilty. Contact tracers are trained professionals, especially this new wave, like I said. They not only have the medical background, they're going to be trained specifically in contact tracing, asking questions, in forwarding your response. It's okay. Know that that's their job. But don't be upset with them. They're professionals. Treat them with kindness, but be consistent. Don't feel guilty if you keep repeating the same thing over again. Like, I'm not sure, I'm in the middle of something, and I'm very busy. That's okay. So what if you can't hang up and you feel compelled to answer their question? Again, in a moment of weakness, okay, you do not need to give additional personal information about yourself. They're going to press you. Remember, these are professionals. They're going to press you for name, age, birth date, address. You don't need to give them that information. You need to give them, by law, information regarding the infectious disease. Okay? If they press you for personal information, then you would answer, and this is going to be a canned answer, one of your canned answers that you've got in your sleeve. You're going to say, I do not feel safe answering that question. Say it politely. If they keep pressing, well, you need to say, and you just keep saying, I do not feel safe answering that question. Say it without any inflection. Practice it. Contact tracers are professionals trained with a script. If you keep politely repeating that same answer, they will eventually move on. The key is to be polite and consistent and calm with the same response. So answer questions that you feel are invasive with, I'm not sure, or I will think about that, or I don't feel safe answering that, and do it politely. Again, don't get upset with the contact tracer. They're only doing their jobs. Just be very polite. Keep saying, I'm not sure, and all of its ilk. Practice those things over and over. If that's the answer you provide, then that's the answer that they will mark down. There are spots on the contact tracer's form that literally say, does not know or not sure as an answer. These are legitimate answers. So don't feel guilty of repeating these legitimate answers. Just do it calmly and respectfully, and most contact tracers will not give you a hard time. Remember, they have hundreds of others to call as well. These are professionals. Also remember rule number 1. So the next time a contact tracer reaches you and they say, can we call you again, or can we visit you again? If they ask if they can call you back again, politely decline and say no, goodbye, thank you. Try to end that conversation as quick as possible. What to do if they come to your residence personally. So if they come to your door and request entry, politely decline entry by saying, I do not feel safe letting anyone in, but I will answer your questions through the door. Remember, we are required by law to answer questions in regards to infectious diseases specific. We are not required by law to let them in our homes or to answer questions that we feel unsafe.
So does the requirement to answer these questions have a valid OMB number?
Every state is going to have a different code per se, but most of those are delineated in state code that you must answer questions in regards to infectious disease when asked.
Do we have the right to ask what that code is before we answer?
Yes, we have the right to ask which part of the code specifically and how is it written. I would like to say that do answer what you can. You don't need to answer, again, questions that make you feel unsafe, especially in regards to personal questions. Full name, age, sex, who else lives there, address, phone number, things like that. That's not specifically related to the condition, to the disease, to the infectious.
So there might be people knocking on our doors.
Yes, most likely. That's right now, that's not common. Again, phone calls are definitely the most common. But eventually, people may be knocking on your physical door to ask you questions. And if so, you can tell them, I don't feel safe letting you in. I'll answer your questions at the door. So here's the inside scoop. The key is to, number one, be polite. Number two, do not feel you must answer affirmative to all of their requests. Number three, by law, must answer their questions about infectious disease. And that is all. It does not state how or where. It does not state that you must let them in your home. It also does not state that you must give them personal information if you feel unsafe to do so. 4, do not let them in your house. Politely decline and say you will answer their questions from a closed door. And 5, it is okay to repeat the same answers, the same canned answers, same answers that you're going to practice and repeat with someone of like mind. And it's good. Make it a game. Make it something where you're practicing with someone so that not only you gain that skill set, they also gain that skill set. You do not need to explain anything further if you use these canned responses of, I don't know, I don't feel safe answering that question, I'm not sure. They're trained professionals and they're going to keep pressing, but you do not need to explain anything further. Simply rinse and repeat these same calm responses without any inflection, and you should be fine. So I encourage you to do this with a like person. So under normal conditions, really the contact tracer is a highly trained professional who usually has a nursing degree or a master's degree or a doctorate degree, specializing in public health or infectious. There is that one period between March and around now where there were contact tracers who were not all that well trained. It was easier to thwart them. Those folks are, we're going to have a new round of contact tracers who are, again, as professional as the former, as professional as ever. And that's why I encourage you, find a like-minded person, practice these skills, practice these responses with them, and they shouldn't give you too much trouble. Do understand this though. Once you're in a contact tracing system, a database, you are always there. And you will, yeah.
Tell me about it. I'm not in a contact tracing, I'm in a resistant database. But anyway, you have given us some really great tips. But what happens if you woke up on the wrong side of the bed, you haven't had enough coffee, whatever, the dog has been just chewed up your socks or whatever, and a contact tracer comes to your door or calls and you lose your cool? What can you expect?
Right. That's a good question. If you lose your cool, the first thing I would do is I would apologize and let them know this is not a good time to talk. I'm not in a good place right now. Can you come back? And be sincere about it. And if possible, do those, go through that scenario that I just went through. If they do come back physically, then do answer them through the door. Do answer any infectious disease related questions through the door. But any questions that you feel are too invasive or make you feel unsafe, go back to those canned answers. It's that I don't feel safe answering that question right now. And as long as you answer the infectious disease related questions, you should be fine. But if you make a mistake, just apologize and ask them to come back.
So can you, if they say, do you have a sore throat? Can you say, I'm not safe? I don't feel safe answering that question.
Yes.
So you can say, I don't feel safe answering symptomatic questions.
I would just put it as simply as possible. The canned answers that I would have is, I don't know, or I'm not sure, or I don't feel safe answering that question.
Which would you use? I don't know, or I don't feel safe.
It really depends. For questions that are of a more personal nature that I don't want to disclose, I would say I don't feel safe answering that question. But do answer as many infectious disease type questions as you can for them. And they're trying to do their jobs. They're trying to keep the public safe. It's just that there are going to be certain questions that you may personally feel are either too invasive or unnecessary, and therefore go back to your canned, I don't know, or I don't feel safe answering that question, and don't feel guilty about saying. Practice it without inflection. Practice it to a friend, to a like-minded person, and you should.
So do contact tracers have to identify themselves as contact tracers? Because my concern is there's the National Community Survey that asks very personal questions, from vaccines to sexual preferences, just you name it. I mean, the thing's like 30 pages long. And how are we supposed to distinguish between a community survey and these contact tracers? So do they carry identification, and are they required by law to identify themselves?
Right. In the rare instance that they come to your premises personally, yes, they must have official identification. And this is going to be from either the county or the state. If you're not sure, you can always call your county health department or your state health department.
So I think we've had some really wonderful information that was just given to us about contact tracing. And so now we should move on to the big one that is going to be slamming into us anytime, and that is vaccines. So what do you have to say about vaccines in general, or specifically? Helpful tips, we'll take anything.
I will not take a vaccine. Of the three categories of public health workers, the county level, the state level, and the federal level, here's my breakdown of how they view vaccine. Most county public health workers are not vaccinated. They choose not to vaccinate themselves. I would say, especially in the rural jurisdictions, and these are people whose job is to vaccinate others. At the state level, I would say most state public health workers do vaccinate. And then we move to the federal level. At the federal level, they're all vaccinated. When it comes to types of vaccinations, I just opt out of all of them, Celeste. Now is a good time because of the quarantine, because of lockdowns, because schools are in session, but it's distance learning that's taking place. Kids don't have to be physically at school. So a lot of things are done online. Business meetings are done online. I would say take this opportunity to look at homeschooling. I mean, they're not getting that one-on-one instruction at their physical school anyways because of all the lockdown. So consider right now homeschooling. There are lots of resources that are available, especially now, very high quality resources that assist with homeschooling. Besides, your child is not going to be inundated with all the propaganda that our public schools have. I'm not going to speak of the quality or the type of education they're getting in our public schools, but take this opportunity, especially since you don't vaccinate, your kid doesn't go to school. Well, then I'm just going to homeschool. Consider that as an option. What else do you want to know about vaccinations?
So we kind of, do you know what's in the vaccines?
You're not stating which companies are have vaccines available. All we know is that the plan is late October, early November is the first round of vaccines will be available. Again, company brand has not been named. They keep saying that there are going to be certain priority population. Exactly who consists of those priority populations, that has not been named. We do know that that's probably going to consist, it's a very good guess, is going to be frontline clinicians. These are the doctors, the nurses, the pharmacists, the dentists, and also long-term care facilities, residents there and workers there as well. It's been identified early on that certain demographic populations will be considered high priority. The Black population, per se. They're also saying that when vaccines do become available, that it's going to be very popular. That's what they say. I don't think it's going to be popular. And so it's going to be only a limited number of vaccines that are available this first round of late October, early November. And they're saying it's really next year sometime. They're not saying when, but next year it should start to be available for everyone. Word on the street is lots of folks do not want to vaccinate. So they're considering alternative incentives, monetary incentives. You get paid X amount, $1,000 if you get vaccinated. So there's going to be the carrot and the stick side of things. The carrot is we'll give you money if you get vaccinated. The stick is going to be, so initially it's going to be voluntary. However, voluntary really means you can choose to take the vaccine or not. We're going to incentivize you with perhaps monetary. We'll pay you $1,000 if you take it. If you don't take it, it's voluntary. You don't have to. But what does that mean? It may mean that you may not be able to go to school, to be able to go to work, to go to the groceries, to go to the bank.
So do you know anything about the ingredients at all in the vaccines?
No, they have not disclosed the companies, the initial companies. Right now, they're saying it's probably 2 companies that will release the initial round of vaccines. They have not identified what those companies are, and therefore we don't know what's going to be in vaccines.
I have a bioweapon lab 3 hours south of me, and they put it on their front page, what there was in their vaccine, and they are a contender, a vaccine with the NIH. They are an NIH facility. So yeah, it was aborted babies, sterilization chemicals, I say it's a cocktail, but they said it was a group of drugs or chemicals to combat non-communicable diseases. And of course, then you've got your adjuvants, you've got your hydrogel quantum dot. So that's what they put on the front part of their website. So what other tips can you give us since the climate is changing, public health is changing, I guess, what do you foresee the next 3 months, the next 6 months and the next 12 months being as far as the landscape of what we're looking at with coronavirus?
The next 3 months is going to be very difficult because a lot of people are saying everything hinges upon the election. But no matter what, whether President Trump stays in office or not, I believe COVID is going to stay with us. If Trump is not in office, I just think things are going to ramp up with COVID. Trump seems to be, he's kicking the can down the road. He's giving us time. So we need to pray for that. We want more time. That's in the next 3 months. In the next 6 months, definitely more lockdowns, more contact tracing, robustness. It's that right now it's commercial companies that are installing the apps. In 6 months, we may have the public-private partnerships that I fear with contact tracing apps. It will not be legal in 6 months, or definitely a year. I don't see it being legal in a year, deleting or deactivating these contact tracing apps. Now is the time, folks, to get that Android 9 phone that has been marked down from last season. It may not impress your friends, but it may protect you and your family's privacy. So get it now. Anytime there is going to be a government partnership with tech, and that's coming. Right now there is not, but it's just a matter of time. When government is partnering with tech, just beware. And then over a year from now, it's not just COVID. It's going to be other infectious diseases. I'm not at liberty to speak on that right now, but do prepare for other types of diseases. The Bible is very clear. It talks about pandemics. It's in the plural. COVID was the starter for this. It set the stage for not only other infectious diseases, but for other things that are going on. COVID really, the narrative for COVID is not about infectious disease. It is not about public health. If it was, the solid science, the protocols of science and infectious disease surveillance and public health would be there. The data would be there. The scientific definitions would be there. The serotypes, the strains, the test kit, all of those things would be there. They would not change without justification. But with COVID, those things are not there. So COVID is not about public health. It's not really about protecting the public from an infectious disease. It's about a political narrative that was designed to control.
Yes, I fully agree with that one. So what do you, I just took a 7-month military course on information warfare, and basically all warfare in the future, it doesn't matter if it's on the medical field or the battlefield, it is going to be managed by the information war. What is your perception of the deaths that we've seen so far in the United States? I'm not talking global. If you want to talk global, you can, and what you expect to see in the next 3, 6, and 1 year down the road.
Right. As far as the official numbers for deaths, if the data is weak and the science is weak, that means the data for the deaths are also weak. The data for how many people have tested positive, that's weak. We went over the 3 different types of tests. Mm-hmm. The PCR test, which is supposed to be very accurate. The serology, or the blood test, the antibody test, that's also supposed to be very accurate. But even those very traditionally accurate tests, they have their issues. And then we talked about the growing antigen test, which is traditionally of those 3, the antigen test is the least accurate, but that is growing in popularity. So as far as the numbers, the data for COVID, uh, I don't believe in the total number of positives. I don't believe in the total number of deaths. If we were to rule out any underlying conditions, if we were to rule out anything else, I would say the true numbers for COVID should be very similar to the flu. Now, the flu kills about 50,000 Americans every single year. And I believe COVID should, if the numbers were scientifically supported, should be about 50 to 80 to maybe even 90,000 Americans have died of COVID every year. But there are great financial incentives to pad the COVID numbers. Uh, Professionals have come out, clinicians have come out with their names, their faces, everything on video with documented proof showing us that there are financial incentives to assign positive tests to COVID when it's not really a positive test. In other words, it's a false positive. And to assign deaths to COVID, in fact, there are either underlying conditions or in fact, it's really not even to COVID. So I dispute the death numbers.
So there's something that I just picked up. So I read the scientific peer journals in many different, from medical to sensors to synthetic biology, yeah, that's what I do in my spare time. And what I noticed starting last week is where they say scientific peer review journal, they began dropping the science, the word science. So it is just evidence-based. And if it's evidence-based, it is subjective, that there is no science much, and that backs up with what you're saying. It's whatever they say it is. So I noticed that starting last week in these peer review journals, they dropped the word science.
Correct. There is an abundance of data on COVID. How is that data vetted though? Does it follow the same strict protocols as other infectious diseases with their studies? Not really. COVID gets a pass when it comes to the data and the science that is supposed to support it.
If you've got the questions from the community, maybe if there's something that we haven't gone over, if you have those in front of you.
Sure. Let me talk about vaccinations, opting out of vaccines legally. There are ways of legally opting out of getting vaccinations. So many jurisdictions do provide the ability to opt out of vaccinations with a doctor's signed consent or for personal religious reasons. So go to your state public health website, search for the following terms: vaccination note, vaccination exemption, vaccine exemption, religious exemption. You're looking for the official exemption forms, and the doctor's exemption form not only must be signed by the doctor, but typically also a notary public as well. So here's the inside scoop. The personal religious exemption form typically does not need anyone's signature except your own. So what that does is that it's certifying that getting the vaccination is strictly against your religious beliefs. That is the easiest form to fill out, and very few people. Let's see if there's any other questions that someone asked about public health officials. So the question here is, are there any public health officials, especially state and local departments of health, who see through the lies and evil agenda behind COVID? So yes, some public health officials do see through the propaganda. However, that number is small. Majority of public health workers I've met are dedicated, they're overworked, they're underpaid, they're underappreciated. And public health being the field that it is, if you do your job well, we talked about this, you're staying out of the limelight. Nobody really knows Nobody really cares about you. You go unnoticed. So most Americans have no idea their public health worker is protecting them from 100+ other infectious diseases that can hurt, maim, or kill them every day. So every time someone buys food at the store, someone takes public transportation, someone swims in a public pool, someone drinks water from any public source other than a personal well, public health is at work protecting them. So most public health workers do not specialize in infectious diseases, and that goes especially for the officials in public health. The inside scoop is what for public health workers to see through the lies being constructed around COVID, they need training and knowledge in infectious diseases. And the public doesn't understand that. The public thinks, oh, you're a public health worker. You know all about infectious disease. You know all about, not really. We don't all get the same memo. We don't all get the same training. Infectious diseases is a very specialized area. And in fact, it's probably the smallest area within public health itself. And not only do they need a background in infectious diseases, but they also need access to the data and know how the data is being gathered. So the vast majority of public health workers and public health officials do not have this background, not have access to the data, and therefore it's going to be difficult for them to make an assessment of COVID. So this type of knowledge and training is really only possessed by a very small team of epidemiologists and infectious disease specialists. For those public health officials who do decide that they want to speak up, they might feel that if they do that, they will make little difference. I mean, there have been infectious disease experts who have spoken out. Most of them have been in the medical and academia fields, and they've been shunned, been attacked by the media, by the machine, and some have lost jobs and some have faced legal harassment. So Ivy League level experts, especially from Harvard, Oxford, Stanford, have repeatedly spoken out for evidence-based and focus-based protection, going against the current COVID narrative, but they're largely being shunned. There are videos out there, very easy to find. They're just not getting any of the headlines. You have to search for them. Let's see, let's look at some other questions. Here's a question that says, I realize this would only be speculation, but do you believe there could be a mass exodus of healthcare professionals if and when the COVID vax is mandated on the medical field in the initial rollout? And yes, I do believe that in the healthcare field, there will be quite a number of people who will quit or take the dire consequences rather than get the COVID vaccination. I don't believe the vaccines are as popular as what is being touted right now. So very few people speak about this openly. Very few people are going to admit that when the time comes, they're just going to not take it or they're just going to take the consequences. But I know of folks who said, I'm not taking the healthcare field, as broad as it is, I would say of those the 4 types that we identified, the clinicians, the administration, the research and development, and the public health, I would say the clinicians have a strong avoidance of the COVID vax, probably stronger than even my own field of public health. Going back to my own field of public health, we talked about this. It's going to be the counties, especially the rural counties. You're going to find strong opposition to getting the COVID vaccine. I don't have a strong feeler as far as the other 2, the administrative and these are going to be present in healthcare systems, HMOs, and I don't have a feel for how they feel vaccine. I also don't have a strong feel for research and development side, so I won't speak on that. But I do feel clinicians and rural health, public health workers are averse to that.
I think R&D is pretty on board with the vaccine. Just from what I've seen, just listening, and I have a wide variety of sources. I'm seeing more resistance in clinicians, like you're mentioning, than I am in research and development. Oh, I'm not too much connected with administration to know what they're feeling, but a lot of the policymakers.
Here's a question. What recommendations would you make regarding Americans' response to an imminent second lockdown, which I assume will come this fall, regarding flu season? What insider knowledge could you share on how we can stand up to the governors and public health officials who promote non-science-based practices? Okay, so I don't believe COVID is going away, and therefore future lockdowns are highly possible. So the response to COVID, as we talked about, it's not driven by public health as it should be, but it's driven by politics, which brings up the point. How can citizenry deal with officials who do not adhere to good science that is based on public health? So the first rule is numbers count. So you alone have little impact. I personally would advise against doing anything that would cause you to go alone and take the brunt of what the political machine has in store. If you do, you will go down flat, hard, and fast. So world-renowned prize-winning professionals have lost their jobs speaking out against COVID, going against the COVID narrative. So how do you think you would do against the same machine? So if you must do anything by yourself without assistance from others, I would say inform those close to you. Be an influence in your world. So behave with confidence and humility in this climate of fear when informing others. In this climate of guilt, shame, fear, anger, be positive. Be that force of positive change. Now, for those of us, for the few among us who are brave enough, and we've decided, I'm going to take on the machine. If you do decide to go against the machine, organize with others. Talk to your church, your civic group, other social organizations, unions. Organize. Know that the machine has plans to deal with every scenario, even with large groups of organized people. But at least you stand a chance, and at least you've made that decision. You've put the line in the sand, and you said, I'm not going to take it anymore, and I'm going to fight. If you do fight, please don't fight alone. It's very easy to become isolated, and for even yourself to feel like a victim of what the machine is going to throw at you. So definitely, if you go up against the machine, don't do it alone. Okay, having said that, also, if you do decide to stand against the machine and you're going to do it with others, know that your county board of health usually has limited access to all the data. So they have access to data that's in their jurisdiction, but not statewide. Use the statewide numbers to your favor if possible. Visit the state website and get those statewide numbers. Also know that most counties are staffed only by a handful of public health workers who are busy and they have other duties. So if you're going to go up against the machine, do it at the county level. You will most likely have better success there, especially if it's a rural county. There are going to be counties out there, especially some of the larger metros. They have very robust infectious disease programs. We're talking Seattle, San Francisco, Houston, Chicago, New York, just to name a few. They have budgets rivaling entire state budgets. That's how powerful it is. So know that if you go up against those counties, that's a machine that you're going up against. You're going to have better luck, especially in the more rural counties. And these are going to be staffed by people who are pretty much just like yourself. It's going to be a handful of people that are working at these rural county public health departments. You're going to get much better response if you work with them, if you organize locally and you work with them and be polite with them, because again, your county public health, especially the rural ones, they're inundated right now. They are not heavily funded like the state, like the federals are. They're very highly dependent on the state and on the feds, and they're just like everybody. They're caught in this huge web that we call COVID. They're not necessarily decision makers. They are pretty much advised to do certain things. And again, because they don't have all the data, it's hard for them to go against what they're advised to do. So if you do decide to make change, do it at the county level and use the state provided data to your advantage.
What happens if your public health goes rogue like my county public health has done? They're going to be the better Nazis than the Nazis. So what do you do in a situation such as that? There are no health exemptions. There's nothing. You will wear the mask. It's just dictatorial at this point.
Right. That's a classic case of don't go against it alone. That's where you are going to definitely need some of the bigger backers, especially with companies that are the larger employers in your area. If you're able to get commercial backing, get church backing, get civic group backing, do it with larger groups. It's just very hard to go up against a rogue public health department alone.
I don't see, I mean, they're all toting the party line. So anybody commercial, I mean, at first there were exceptions because our governor had said, if you have health problems, you don't have to wear a mask. And now it's, you have to wear a mask. You have to wear a mask all the time. We don't care if you're climbing a mountain. We don't care if you're in the car. We don't care if you're shopping. We don't care if, you cannot, basically the very things that are talked about in the Bible that you can't buy or sell. You can't do it without a mask at this point in Montana anyway. And I don't see anybody commercially bucking the system. Nobody. I mean, any of the big, well, it's not a panacea big anyway, corporate anything in Montana, but because we just have the Chinese box stores. And of course, all those guys are, interstate. They have set their policies. So it's not a state policy. But so I guess there's just not much if, you can't get anybody big and it's only a handful of people that are saying no, which that's alluded to in the Bible too, then, I mean, literally, I've been forbidden from buying food in this state at this point.
Correct. We are going to be the holdouts. Our stance is not going to be the popular stance, just as you had mentioned in the Bible. The Bible talks about that. Book of Revelation even says that the beast is going to wear out the saints of the Most High. We have to be in this for the long. Don't feel like you have to fight every battle. Don't feel like you have to win every battle. So pick your battles. This is a time for us to be very close to the Lord Jesus as believers. This is a time for when the world is going crazy, when they're losing their minds. This is the time to be Jesus Christ to them, to be a voice of reason, to be kind and to be loving and to be humble and to be courageous and not fearful. Even if we don't wear the mask or don't believe in the mask, even if we don't want to get vaccinations, we don't want to condemn others that do. I mean, we were all in a position at one point in our lives in which we were, we did not have knowledge that is provided to us from God. So now is our time to be salt and light to the world. We're going to be the minority. If we decide to go up against Goliath, pick those stones, pick those smooth stones and wield them well. But know that giant is there and he's big and he's powerful. And we should not do it alone, especially we're a community and we have God on our side. Eventually, the battle is won, the war is won. The Lord Jesus Christ will come back. This is a short amount of time in which we have to endure this. I don't know how long this marathon is going to be. It's definitely not, a short race. We have to be in this for the endurance. And until the Lord Jesus tarries, we're going to be here together. informing each other, encouraging each other. We're not going to act in panic and in fear like the rest of the world. If we decide to go up against Goliath, let's do it together, and let's do it with joy, and know that we will be beaten down, but we will not be defeated. We will be attacked. But, our life and his glory will continue. We're going to face opposition. We're going to face hardship in this world. COVID is just one small chapter in the large chapter of everything that we believers are facing. So in this time, for the unbelievers that are out there who are listening to this program, if they are, now is the time for them to make the decision regarding Jesus Christ. In this climate of fear and uncertainty, Jesus Christ is my rock. He is my joy and my strength. I am in the thick of the propaganda. I am in the lion's den every day with my job. And the Lord Jesus Christ is my wisdom, my knowledge, my joy, my strength. For those who do not have that, seek the Lord. Make a decision. Make that priority to find out, is Jesus Christ who he really says he is? And make that decision. Seek him out with research. And then eventually, I hope that you will make a decision, yes, that Jesus Christ is Lord and Savior, and that he is the God of the Bible, and that he loves you, and that he has a greater plan for you than all of what this crazy COVID narrative is, and that you can be part of his family of believers who are protected by him, who are saved by him. So if you're an unbeliever, make this a priority. That question about Jesus, is he really who he claims to be? God, Savior, a person who can take all of your sins away because he paid for them. Can he really do that? The Bible says if you search him with all of your heart, you'll eventually find him. Let me see if I can find any other questions. And then we can recap it. We've hit on lots of topics today. Okay, here's one. I just read two sources today, September 30th, that a former Pfizer executive says that the second wave is a total fraud. He continues to say that the pandemic is over. This 16-year veteran executive in a bombshell interview unveils the fraudulent false positive testing for COVID-19. The media is using the false positives to try to whip up mass hysteria over a pandemic that has largely been conquered in the US. He says lockdowns should have been ended long ago. Is this true? And if true, then what is preventing those at the top, including President Trump and this new Dr. Scott, not Big Pharma, FDA Fauci, he never shuts up, from proclaiming this truth and getting this country free to live well again? The lockdowns, etc., have caused more misery, depression, and death, and on and on and on. That's the scary virus. I am looking forward to your answers. Okay, so two valid points. So a big fish insider goes against the machine and declares the actions of the machine invalid. How does the machine react? Most likely he will be shunned, dismissed, falsely accused, attacked, and may even face legal harassment. If other big fish, such as President Trump and his appointed health officials, go against the machine, they too will face the same fate, as we've seen over and over again. Every day, Trump is blasted by the media and criticized for every move. His appointments get the same treatment. So the point of the machine opposing reason and logic is simple. It's all about control. The machine does not gain control if people are strong, if they're focused, if they're reasoned, if they're healthy, informed, and united. The machine must continue this cycle of misery, depression, death, fear, shame, guilt, suspicion, because it weakens the populace. A weak populace, easy to control. So what is the solution? We still live in this world. We still have to deal with the situation. What do? Stay informed, but know when to disengage from the bad cycle. Stay close to God. Take these times to pray and meditate. Talk to God. Talk to the Lord Jesus for us believers. Take personal measures against things that will be coming, not just for COVID, but for all the things mentioned in the Bible. We talked about Revelation. Prepare to meet your Maker. The good news is that Jesus Christ is coming and he is in control. I'm a firm believer in the Christ of the Bible, his birth, his death, his resurrection, his love, and his power. I want that peace for all of us, for believers or non-believers. Again, for non-believers, seek that main question. Who is this Jesus Christ of the Bible? Is he? My answer to you is, I hope you say.
And I think those are good words to close on for this evening. We've done quite a bit of exploration on surveillance, contact tracing, testing, and the vaccination. And I hope that this was useful for all of you. And if you do have questions for Sammy, you can always put them on band. You can email them to me at celeste@celestialreport.com, and I can get them to Sammy, and maybe he would come back for a rerun. We were having some technical difficulties tonight, but maybe he would be able to come back and answer some more of your questions as this continues to unfold. So this is Celeste with Celestial Wonders. Thank you so much for joining us, and we will see you next week.